guys, so today we are going to talk about labor prep and what that looks like. A lot of the time we have some ideas that, you know, to prepare for labor, it's usually just one treatment to come in and get acupuncture, and then that you're just miraculously going to start having contractions and the baby's just going to come so quickly. But what we're going to talk about today is how to create an optimal last 4 weeks of your pregnancy to prepare you mentally, physically, and emotionally for labor, for all the changes that are about to happen for you and for your family, and what that looks like. So I have Yasmin here, who's about 36 weeks pregnant, and we are going to work on just helping her feel emotionally well, address any aches or pains, and get her sleeping so she can restore her energy and feel prepared for labor. There are some statistics that say with labor prep, generally about 37 weeks, roughly about a month before your due date, you can see changes or you can have a quicker delivery time. So the average for research for mothers that have had subsequent children, I think it was about 6.5 hours of labor versus 8 hours in the control group with acupuncture. And then as far as cervical ripening and getting ready for, like, before an induction is scheduled, say your OB wants to has an induction date scheduled so many days or weeks after your due date, then you can start having acupuncture treatments every other day past your due date to help promote cervical ripening, to increase circulation in the low back, to help relax the ligament that lies over the uterus, to help you emotionally with any anxieties or stress, help you sleep, reduce aches or pains, anything that can tense you up emotionally or physically to help you have a better labor, a quicker labor, and better outcomes. There are studies that show women that do acupuncture for labor prep have less interventions, medical interventions, with their labor time, less C-section rates, needs for epidural, and needs for Pitocin, excuse me. So the tools that we use obviously are acupuncture, so needles, and then acupressure, heat therapy, and even E-stem. E-stem has shown success rates equal to using prostaglandins to soften the cervix and promote labor. So with that, we're going to start. I just want to show you a couple of what it looks like. Yasmin, are you comfortable?
I am, yes.
So we've already done an intake. She can just fall asleep on the table. It's actually pretty relaxing. We're going to do some points to help support back pain, make sure baby is in optimal position, head down. Occipital anterior, acupuncture can help with that, and just get her relaxed and feeling well. So yes, we're going to start. So I'm going to put a point Yin Tong and one on the top of the head. This is to help with any stress management and to clear the mind and get her ready for her treatments. These points are safe. They won't induce labor. And the needles are only used once. They're sterile, filiform needles. And with her needle retention, the time she'll rest on the table is about 25 to 30 minutes. How does that feel?
Feels good.
So sensations that you can feel during a treatment are your muscles relaxing. You can feel tingling, warmth, feelings that you don't want to feel, or anything sharp or burning. And what happens is that pretty soon you'll just relax and hopefully sleep. Have a restorative nap session on the table. In these sessions, you can hear maybe some of your stomach gurgling. Not saying that her stomach is gurgling, or a baby can start moving, which is pretty normal. So we're just working on getting her nice and relaxed, muscles nice and relaxed, and building her energy up here, promoting proper circulation, keeping her blood pressure in a healthy range. There are no concerns there. And just getting everything in order for a healthy, happy delivery. Now, if you have any questions, you can post the questions, or you can private message me on the Luna Acupuncture Facebook page. Because of the setup right now, I can't see any questions if there are any. But I will get them answered. Everything feels fine?
Yes.
Okay, good. These points, these needles are as thin as your hair. About 18 to 20 of these can fit into a hypodermic needle. Does that feel good?
Yes.
You've got one more, and then I'm going to let you rest.
Sounds good.
All right. This tool I'm using here is a TDP lamp. It has a little mineral plate on it, and it's just nice and warming. It will help relax the muscles in her back for any lumbar pain. Okay, and so that's just a little peek into an acupuncture labor prep session. Nice and sweet, tailored always to the mother's presentation. It's never the same treatment for each person that comes in, and ideally to prepare once a week for the month leading up to your due date. And then if you have an induction scheduled beyond your due date, then coming in at least twice a week to prepare and promote cervical ripening and helping you emotionally and physically feel the best that you can to get you through and to get you prepared. And like I said, if you have any questions, feel free to send me a private message, or you can post it at the bottom of this video and I'll reach out to you. If you feel like somebody could benefit from this video, please share it. And let's see, I think that is it. Thanks so much for watching. Let me turn this guy off. Hold on 1 second.